Good afternoon, everyone. Thank you for being here. In the last 2 months, with a collective effort of the City of Dallas, Dallas County, the federal government, the state government, and the private sector, we've seen significant increases in COVID-19 testing in the City of Dallas. We know this in large part because we've been tracking it. At the beginning of our response, I issued emergency orders requiring the reporting of tests conducted in the city. We knew then that testing and data collection generally would be critical to our public health response and our recovery efforts. But, like everywhere else in the United States, we need far more testing. As of today, we have still tested less than 2% of our population in Dallas County for COVID-19. And with businesses gradually reopening in Texas, the need for a more robust testing regime and a focus on healthcare access is even more vital to ensure public health and to restore our vibrant economy. I am not interested in finger pointing or playing the blame game with testing availability. We are where we are, and we know we aren't where we need to be. Regardless, we have been grateful for the federal and state support we've received so far, and we appreciate the work of Dallas County, our contracted public health authority, and some of our private partners to bring more testing and improve healthcare access in the city of Dallas. But COVID-19 has required a multifaceted response, and testing and access are just a piece of a larger effort. And as much as we rely on Dallas County as our public health authority, about 44% of the county's confirmed cases are not City of Dallas residents. Our job as city leaders is to look out for our residents' interest. Currently, none of us here at Dallas City Hall have an expertise in testing or in analyzing health disparities in our communities and recommending measures to overcome them. While we haven't yet seen disproportionate health outcomes by race in the Dallas County data, national data has shown some broad disparities by race, ethnicity, income, and other factors in COVID-19 hospitalizations and deaths. In our city, I'm concerned about the many families that don't have the same access to health care and testing as others. It's become clear to me that we need someone who can work with all of our partners, but is singularly focused on these complex issues for our residents. That's why I'm excited to announce today that I have asked Dr. Kelvin Baggett to serve as the City of Dallas COVID-19 Health and Healthcare Access Czar. Dr. Baggett couldn't be here with us physically today, but I know that he's excited to take on this challenge. I'm sure you'll be hearing from him in the days and weeks ahead. He has a very impressive background as a healthcare executive and physician, and he understands and embraces the challenges that I have asked him to take on. We have to make sure all of our communities have access to testing, that we are effectively conducting contact tracing, and that our residents have access to health care. Dr. Baggett expects to work with the City of Dallas, Dallas County Health and Human Services, our hospital systems, our private sector partners, faith leaders, academic institutions, and the Task Force on COVID-19 Economic Recovery, which, as you know, is being led by former President and CEO of the Federal Reserve Bank of Dallas, Richard Fisher, and the Baggett Group CEO, Fred Perpall. This is an all-hands-on-deck situation, and it has been from the start. This pandemic affects everyone, not equally, of course, but no one is immune to the effects of this insidious virus on public health and our society, broadly speaking. I'm very grateful to have Dr. Baggett on board. I'm someone who believes in the importance of science and the power of expertise. I'm also a believer in the intrinsic value of communities. We cannot leave any of our city's people behind in this response. We have too many divisions in our society as it is. This disease has pushed us away from each other physically, but we cannot let it tear us apart and deepen the divide in our city between the haves and the have-nots. I am extremely proud of how the people of Dallas have responded so far to this unprecedented pandemic. We've seen a lot of voluntary compliance, individual responsibility, and incredible generosity and kindness. I know this has been difficult, but Dallas, as always, has risen to the occasion. But I also want to say, I realize that not everyone is getting the message about how serious this pandemic is. We need every single person in this city to recognize that they have a role to play to get us through this situation quicker. This virus is still spreading. People are still dying. We need you to hang tough. Wear a mask when you are out in public. Wash your hands regularly. Practice social distancing. Now is not the time for a party in the park or at your house. We're not out of the woods yet. There will be a time to celebrate in this city because we're going to get through this. And I look forward to that day. It's just not today. Thank you very much for being here, and I'll now turn it over to John Fortune, who is one of our assistant city managers, to say a few words about enforcement and testing. Then I'll be happy to answer any questions. Thank you very much. John?
Thank you, Mayor Johnson. We're very blessed to have your support as we continue to provide response to this COVID crisis. As many of you are aware, we have been operating 2 community testing sites since early March, and these sites are at the Ellis Davis Fieldhouse and the American Airlines Center, as you know. We originally started with approximately 250 tests daily at each of these sites, which was ultimately increased to 500 tests at each site on April 16th for a total of 1,000 a day. However, as we began looking at the needs in the community and to ensure that we are serving our high-risk populations, on April 30th, we started allocating approximately 300 of those tests daily to Parkland Hospital Mobile Clinic to perform testing at high-risk locations. Those locations would be like nursing homes or senior living centers. And we know, based on the mayor's request, that labs report their testing data to the city, that there's approximately 800 to 900 tests that are currently being conducted daily in the city of Dallas. So with the current 1,000 a day at the community testing sites and the private labs, there's approximately 1,800 to 1,900 tests that are conducted each day in the city of Dallas. However, that's not enough. We know that through conversations with the health department and through just the health professionals that there's a need to improve the level of testing, and we would like to see that number to at least 4,000 tests a day. And I know that through the mayor's office and his support, he's making requests to the appropriate federal officials to seek extension of the testing that's currently being conducted at the community testing site beyond May 31st and to expand it. And so going forward, some things that the city of Dallas is doing specifically, we're looking to improve that testing capacity that's available to some of our population who don't currently have the means for traveling and making their way to an existing testing facility. And so tomorrow, the City Council will consider a contract that we've established with a vendor in consultation and collaboration with the county to provide for mobile testing. This contract will provide up to 60 tests per day that will be provided in targeted zip code areas. Those zip codes would be the areas of the city where we're seeing the highest incidences of positive cases. And it's our hope that this additional testing will fill the void for those individuals who currently do not have the means to travel to an existing site. So, we think this is an important enhancement of the level of local testing. We would like to see this grow as we see how it works and how productive and effective it can be. But, going forward, we're hopeful that the federal government will continue the support of our testing capacity at the 2 testing sites. But, should that not be possible, we're not going to just sit back and just do nothing. So in collaboration with the county, we're continuing to have conversations and developing options to be able to not only continue testing at the community testing sites now, but also to expand that going forward. And as we develop those proposals, they'll be coming forward to the city and the county for consideration by those bodies. Now, as it relates to enforcement, I would just like to kind of piggyback on what the mayor said, just how important it is that we continue to be vigilant and we continue to be aware of each person's role in protecting not only yourself, but your fellow neighbor. And, we're in this together as a city of Dallas. And so I am happy to tell you that our enforcement teams, as they've been out in the community, are seeing a significant level of voluntary compliance. In fact, we have only issued just approximately 30 code enforcement violations through our enforcement efforts up to this date. And that's out of almost 19,000 service requests that we've had. So that tells you just the significant level of attention, the significant level of support that this Dallas community is providing to each other as we deal with COVID together. And so with that, in closing, I would just like to thank again the mayor and the city council for their continued support and leadership for this incident. And I will turn it over to Tristan for any questions. Thank you.
Sure, we'll open up the questions. Jack, good to see you. So the question was, first of all, Dr. Baggett's background, and what specifically the mayor is looking for, and could you repeat the second part was about the city of Dallas. What is the city of Dallas doing to find more testing? Got it.
Appreciate the questions, Jack. So first of all, with respect to Dr. Baggett, his background and what I'm looking for, he has an incredibly impressive background almost ideally suited for what I'm going to be hoping he does on the city of Dallas's behalf. He's a licensed physician. He's no longer practicing medicine. He's in healthcare delivery. But his background, he has a master's of public health and epidemiology, which is perfectly appropriate for this situation. But he's also someone who I think has experience based on his experience in the healthcare delivery space, understand the players involved in healthcare delivery, and he has a background and also in analyzing and looking at issues related to health disparities. And so he's going to be kind of a do a lot of things person for us. He's going to be looking at how we improve and increase our testing capacity here, coming up with different approaches and strategies for how we might do that. He's going to be able to, I think, work well with all the different players involved. So, the city, the county, the hospitals, the universities. He's going to be able to bring those folks together and figure out how we can improve testing, how we can improve contact tracing. He also has a background with the Masters of Public Health, which is a different background than the medical, the MD background. We're not asking him to compete with all of the different medical doctors who are practicing physicians who are giving us advice on how the disease itself works and, what can kids spread it or not, how, asymptomatic carriers, or how prevalent is it? That type of thing is really being left to the county and Dr. Wong. His role is going to be trying to help us figure out strategies for improving testing and contact tracing, and also helping us look at data. The MPH degree, the Master's of Public Health degree, largely is about analyzing public health data and understanding what we can imply from the data and what we can't, what we can extrapolate from the data and what we can't. And we want to make sure that we are on top of and ahead of any disparities in how this disease is affecting our population. We want to understand how it's moving in our community, how it's affecting people of color, low-income individuals, frontline workers, anything that shows a disparity in the impact of the disease, we want to be able to get out on top of and in front of so we can address it. So he's going to be doing all those different types of things. As far as working with the county and any of our other partners, federal partners, on testing, what we've been doing and what I've been doing is trying to get every single person who is able to help us with testing to do so. So early on in this process, I reached out to the state and to our federal partners about getting more testing. That's how we ended up with the mobile testing sites that we have, the drive-through testing sites that we have, the federal sites that you have heard discussed today by Mr. Fortune. That's how we got Walgreens. That's how we got Kroger's. It's all that outreach to folks who have the ability to help us with testing. And I'm going to continue to do that. I'm also going to continue to advocate with the federal government for more resources for testing, because we really do need help with that. This is not something that our city is really designed and built to do. Public health is something that we work with the county primarily with, but we understand that we have some unique challenges facing our city. The county is more than just the city of Dallas, and so we want to do our part. We're not interested in playing the blame game. We're not interested in, criticizing how we, what we don't have in the way of a testing infrastructure. We want to work very, very hard to make sure that we're testing as many people in Dallas as we can, and we'll work with whoever we have to do it.
I'll take a little bit of that and then see if John wants to add anything. Initially, I think this was supposed to expire April 10th. Right. So on April 10th, this was initially supposed to expire, and we actually got within, I think, a few days of that happening before we got a federal extension to the 31st. So there's not been anything that I know of that's happened since then. It's just that we're now looking toward the end of the month, and we know we've seen an increase in cases. So we want to be able to extend that because we know we're going to continue to need the testing infrastructure. It's not as if anything has changed since then, other than, we've had it since April 10th. So I just want to make that clear. There's nothing that the federal government's done to make us think that they're not going to, or that they are at this point. It's just we're looking down at the end of the month and trying to plan ahead. John, do you want to take that? The question was, there's nothing to give us any cause for concern. So.
No, there isn't. In fact, I would just reiterate what Tristan just said. We received an extension on May 31st, and just like we did in early April, we started looking at options beyond that should the testing not continue. We're hopeful and optimistic that the federal government will provide an extension for that, but absent specific knowledge to that effect, we're making every plan that we can to protect and test our citizens, our residents.
Yes.
So a question for you. Are you able to provide the numbers of positives in cases that are coming out from these test sites? I know the county has those numbers too, but I was wondering if you all have
the numbers that you get from the county are essentially the numbers. There's sometimes a reporting discrepancy in terms of what day the test was taken and what day you get the results, because it might take a few days. But the county's numbers are the numbers, and that goes for Collin and Denton County. We have residents there, so we get the breakdown, I think, from Dallas County every Tuesday and Friday in terms of how many of the county residents are our residents versus other county residents, but how many are in the city of Dallas. So the county numbers are the numbers. There's not really a difference. Yes.
Do you have an update on the hospital situation with the increase of cases into hundreds like each day for capacity, hospital capacity, ICU unit?
Oh, the question is about hospital capacity and whether we've had an increase. Yeah, we've been tracking that every day. If the mayor wants to talk about that a little bit.
So we look every day at the hospital capacity numbers, and by hospital capacity, we were specifically tracking hospital beds, ICU beds, and ventilators. We ordered that several weeks ago as part of one of my emergency orders so that we could keep our eye on where capacity is in the city. The reason why that was important to me was because I think everyone understood at the beginning, and I want to make sure everyone continues to understand that when we talk about flattening the curve, the goal of flattening the curve is to keep your hospitalizations within your hospital capacity. So you have to know what that is. And so we've been looking at that, and it's been hovering around, in terms of ventilators, in the 30% range, between 30 and 40%, never really exceeding 40%. So we've never had more than 40% of the city's ventilators utilized on any given day. And as far as beds are concerned, the hospital beds, the general beds, have been in the 60% range the whole time. Never gotten any higher than in the 60s. And same with ICU bed capacity. The highest it's ever gotten is right around 68, 69% or so. Never exceeded or hit the 70% number, which is a number that some people think is where you want to start really paying attention. So we feel pretty good about where we are with respect to hospital bed capacity, but we want to keep our eye on it because, again, that's the extent to which you are unable to deal with any surge in our cases. So those numbers have been holding relatively steady.
Yes. You say 4,000 or 2,000? 4,000. Okay, I know we're requesting to go up to 2,000, I think. But John, you want to take that?
So, thank you for the question. The 4,000 number is just a kind of a per capita guide that came from the health department. And clearly, our objective would be to get there as quickly as we possibly could. And so there isn't a defined time frame for when that would occur. Obviously, it requires acquisition of tests and the capability of administering them. And so there's a level of logistical details that have to be established prior to us opening that service to the community. But the 4,000 number is a guide. I think that there will be an interest in targeting all nursing homes. We heard some information from the governor about that this week, as well as other high-risk, potential high-exposure type locations. That may be something that we want to test, those areas more frequently than what we currently have the capacity to do and to perform. So,
I just want to add something to that response. The timetable for testing, let me tell you, I guess, how I look at that and why I think this testing issue is so important, and why we're here today talking about testing at the city level, which, again, I think I've tried to emphasize that, would a federal testing approach be great? Yes. Can we talk about, how we got here? We could. What's most important is what we do going forward, and I'll tell you why it's so important. As we have now started to move from the purely public health focus of this discussion to reopening the economy, I think it's critical that people understand this. The economy will not be reopened by legislative fiat. The President of the United States, the Governor of Texas, the county judge, the mayor of Dallas, none of us can, by simply saying the economy is open, make people feel comfortable enough to actually go back into that economy and participate in it. We will never be able to come back as a city, come back as an economy, until people feel comfortable doing so. That's not something we can just snap our fingers and say, tomorrow, go back to normal and participate in our economy again. The thing that will get people to that level of comfort and that will actually bring this economy back is the knowledge that only testing can give you about where the disease is in your community and how widespread it is. That's the point. That's what it's all about. The testing is what gives us the knowledge of how widespread the disease is in our community and where it's spreading. Until people have that comfort level and that knowledge, they will not return to the economy at the level that we want everyone to return to the economy and participate the way we want them to. So we have to be focused on making sure that we expand testing and contact tracing so we can get to that level of comfort as soon as possible so we can get back to life as normal. But that can't be done until we get testing where it needs to be.
All right, we'll take one more question. Yes.
You mentioned there were about 30 violations, citations that you gave. Do you have more specifics on that? Just talking with people out on the street, business owners, they sometimes tell me, I don't even know if I'm doing everything right, so maybe if you can give some examples, they will have a better idea of how to avoid that.
Right. The question was about the citations that we've received and how we can give people some guidelines about following the rules. John?
yes, thank you for the question. And let me begin by just, again, stating just the tremendous level of voluntary compliance that we've received. The majority of the violations that we observed were addressed very easily through just a notice to the business that there was some problem. The 31 violations roughly break out into a variety of categories as it results to the specifics of the order. So I don't have that information with me, but I can tell you that it was only after the business owner opted to not participate in voluntary compliance that they were issued a citation, and generally it was for the specific details. I just don't have those with me today.
All right. Well, thank you all for coming, and great job on the masks, everyone. Let me know if you have any follow-up questions, and we'll deal with them. Thanks.